I just wanted to let you guys know I'm 10 days out from hip replacement surgery, so I'm not exactly camera ready yet.
Get that.
But I'm here in spirit.
Hope it goes well.
How do this here? Judy, it's 8 o'clock. Okay. Audio is very, Judy, your audio is very, very garbled. So maybe closer, turn up the volume.
Also.
Okay.
My volume is turned all the way up, and I'm within. Okay, we'll start it. February 2nd. And I'm asked to share some information. We need fashion. Unless they're actually speaking. Feedback and other background noises that people reporting, or for us to hear everyone. And if you've got a question or a comment, would you please wait? Don't you? And then for Bobby. We had a little bit of a challenge last month. At night when we're calling microphone roll.
Bobby, do the roll call.
Sue Ashton. Heidi Basford Kirkhoff. Julie Kiefer. Julie Davids.
Here.
Ron Durkott.
Here.
Lindsay Temple.
Here.
Kowski is excused. Judy Ritchie. Deb Allison Osby.
Here.
And Julie Kiefer, you are here?
Yes, here.
Okay.
Thank you. Moving on. For approval of the January minutes, does anyone have?
I'd like to make a motion that Ron Durkup, I'd like to make a motion that in section H, that A, B, and C in that section under other business be deleted. That was covered in the November minutes.
And
Would you like me to repeat the motion?
Does anyone want him to repeat what he said?
No, you're good. You're good, Ron.
I need a second for that motion.
Second.
Who was that?
Yeah.
Deb Allison Osby.
Right. With those.
I move to approve the minutes.
Please. Second.
I'll second that. This is Ron.
Okay. Approved.
None.
Public comment.
I did not receive anything. No.
Ron, would you like?
I'd be glad to do that. This morning we welcome Beth Meltz. She's pictured on the screen here, so she's in her box. Beth is a retired social worker, having served for many years at the Winnebago County Department of Social Services, Human Services, and Aging and Disability Resource Center. She also worked with the management group as a screening specialist and later was one of the workers at Brewster Village in Outagamie County. She's, as I mentioned, retired now, and she's going to share her experience with COVID and her Facebook support group this morning. So welcome, Beth. We're glad you're with us, and
Thank you.
you have the floor.
Thank you, Ron. Can everybody hear me okay?
Yeah.
Okay. Ron was my boss for many a year, and I continue to tell him that he's the best boss I ever had, and I still mean it. So just wanted to say that. Okay. Ron asked me to share, as he said, share my experience and then talk a little bit about a support group that I found. So that's what I'll do. I wrote some notes so that I didn't just wander aimlessly. So please excuse me that I'm looking at these notes and kind of following them. My COVID symptoms appeared on, yes.
We need everybody to mute that's in the background because we can hear TV or some noise and it's hard to hear Beth.
Okay. Okay.
I think
My COVID.
Sue asked and it needs to mute her.
All right, well, I'll mute here.
Okay. All right. First of all, thanks for having me. All right. Second of all, here we go. My COVID symptoms appeared on April 2nd of 2020. Just as a little background, the Wisconsin stay-at-home order occurred beginning March 25th of 2020. During that 8-day period, I was quarantining, I was washing my hands. We weren't wearing masks at that point, unfortunately, because that's when they were concerned about having a shortage of PPE, so I wasn't masked. But I had only gone to 3 places during that time. One was to High Cliff, which is where I take my dog all the time by myself, so I didn't get it there. Another one was I went to the grocery store once, and I went to a previously scheduled doctor appointment. On the evening of April 2nd, I had the chills. During the night, I broke out in a drenching sweat, despite still having the chills. I took my fever in the morning, and it was 102.8. My normal temp is 97 or less. I called the doctor's office, and they told me that since I did not have all 3 of the then official COVID symptoms, they were not seeing people. If I recall correctly, and Doug would know more about this than I do, I'm sure, but those symptoms were fever, which I had, difficulty breathing, which I didn't have, and shortness of breath. I think cough might have been in there or shortly after, and I did have a little bit of a dry cough. I have to say that at that time, the doctor's offices didn't know much, and I didn't blame them for that, but it was difficult because they weren't a great source of information, and therefore there wasn't a whole lot of reassurance that I got from them when I called. I continued to have a fever and drenching night sweats, at times changing my pajamas 2 times per night. I was extremely fatigued, spent most of my time sleeping. I had no appetite, but knew I needed to at least drink fluids. I live alone, but was blessed to have friends who were willing to go to the store and drop things off on my porch. My mouth began to hurt in the 2nd week. It was painful to try to eat anything, even if I had an appetite, which was very rare. I had difficulty swallowing. About 6 days in, I decided I'd better look at my throat and found one tonsil so large that it touched the uvula. It had white spots on it, so I called the doctor and wondered if I had strep. They did tell me to come in then, and I had to drive myself, as who are you going to ask to take you when you had COVID, or suspected. It wasn't strep. The doctor said he couldn't give me a COVID test, as they weren't doing those at that time, unless you were hospitalized. However, he put in his notes that this was probable COVID and added in his notes that he couldn't test me because of the shortage of tests. I would also develop symptoms out of the blue, which would appear and then 2 days later disappear. For instance, I had significant pain in both of my hands for 2 days, and then it was gone. Or I had flashing lights in one of my eyes for 2 days, and then that was gone. It was like the virus was like, here, take that, and then it would try something else. I'm sure that there was more. I can't really remember because I was sleeping most of the time. I was extremely weak. I understood why it's important for people to have raised toilets and grab bars, because that was one of the toughest things that I had to do, was to get myself on and off the toilet. My left leg began to hurt on day 24. After a few days, I thought I had better call the doctor, as I had heard blood clots were potential with COVID. Did not have the usual symptoms of a clot. There was no redness. It wasn't hot to the touch, but I was concerned, so I called the doctor. I was sent to ER. It was a Saturday. And it was confirmed that I had a clot in my left leg. So I started on blood thinners and remain on them. I want to emphasize how important support is when someone has COVID. When I had it, Wisconsin was just beginning to see it. There was a shortage of information. I felt very isolated, despite wonderful friends who called and texted, and very afraid that I would end up in the hospital on a vent, because that's what we were hearing about at that time. My cousin called at one point crying and said, I don't mean to scare you, but I hear this thing can escalate really fast, and I need to know who to call if you end up in the hospital to take your dog and cat. I became a little short of breath, but never got to the point of needing hospitalization, thank God. I would make it a point of trying to be awake during Governor Cuomo's daily briefing, as he was the only one that provided consistent, reliable information at that time. I lost 28 pounds in less than a month. I always say that the COVID diet is very effective, but I don't recommend it. Some of my symptoms, such as the sores in my mouth and the 2-day phenomena, were not identified as COVID symptoms, which led some to tell me I must not have COVID. In May or possibly June, I came across a Facebook site called Coronavirus Survivors Group -COVID-19. I quickly joined and found people posting things about sore mouths and other symptoms I had and asking if others had those symptoms, to which people would reply, I did. This was invaluable to me as it affirmed what I already knew. I was a COVID survivor and that everyone's experience was as varied as the people who had it. We know that now, or at least I hope we do. But if you as a group can do anything to promote support groups or webinars or links to people who have had COVID in any way, you'd be providing an invaluable service to the citizens that you represent. I believe Prevea has a group, and there is at least one group in Milwaukee, I understand, but more are needed. Again, I count myself as one of the lucky ones. However, having said that, it was a terrifying experience, and I'd never been so ill in my life. Plus, friends and family can't provide in-person support due to the risk of being exposed and getting COVID. It was very isolating. My only remaining problems I have, as far as I know, are some shortness of breath, which you can probably hear as I talk, fatigue, and being on blood thinners. I did have the brain fog that they talk about. That lasted about 6 months, but that's gone now. And then, of course, I have lots of PTSD. I'm terrified of getting it again. I'm rabid about people wearing masks. I get my first COVID vaccination this week, and I'm really grateful that we have a vaccine and we can hopefully get a hold of this pandemic. That's what I have to say. I hope that was helpful. Does anybody have any comments or questions?
Can you share a little bit more about the group, or are you going to be sharing that about the support group?
That's the Facebook one. That's the one I was talking about. Again, that's an informal group. It's just a Facebook group, but it is extremely, people continue to write in and say, I had this, does anyone else have that? And people can say, yes, I did. Or what did you do for this? And people can say what they did. Or, there have been some sad ones where people say, I'm on my way to the hospital. I'm going to have to be vented. Pray for me. It's just a wealth of information. And again, that's for people, though, who aren't on Facebook or don't have a way to access that information. I think it would be super important for somebody to research any of the groups that are out there, post them somewhere, or spread that information so that people can easily access them. When you're really ill, you don't have a whole lot of energy to do a whole lot of digging. So it would be great to have more of that kind of thing out there for people. Does that answer your question?
Yeah, is that Facebook group a private group, or that you have to be to join in?
You have to join, but I had no problems joining.
Okay.
Yeah, it was, and it's getting bigger all the time, of course, as more people have COVID. So, but I guess I went back and I looked because I don't think I found it till May or June, but I think it looks like it was started on March 3rd, and it would have been invaluable to me had I had that while I was sick. It would have reassured me so much that others were out there. Because like I said, the only ones you were hearing about at that time were the people that are ending up in the hospital and on vents. Now we know that there's just a whole line of, people with no symptoms to people who end up dying. But at that time we didn't.
Beth, how did you come to know about the support group, the Facebook group, in the first place?
I can't remember how I stumbled on that. I don't know if I entered something and it came up or if it just happened to come up. I can't tell you. I was trying to look back when exactly it was I joined, and it wasn't showing up. I just remember coming across, nobody told me about it. I just happened to stumble upon it. But I'm telling everybody that I can about it when I hear that anyone has it, or that their daughter has it, or son has it, or mother has it, or whoever has it. You know, certainly because it's not a professional group, there are things on there, just like any other group, that you just have to disregard. But really, I have found it overall very helpful. It's monitored to make sure that things aren't put in there that shouldn't be.
So, Jean, is that something that could be put on the Senior Center's Facebook page in terms of resources for people who are struggling with the long-term effects of COVID?
Yeah, I mean, that's something Ann and I will look into, and then we can see how we can, either we can put that communication out that route or in another.
Okay.
So.
Do you want me to? I'm sorry, Ron.
Go ahead,
I was
Beth.
just going to say, do you want me to give you that name again, just so you have it?
I think
Or did you?
it's Facebook Survivor Group -COVID-19.
Okay, it's Coronavirus
Oh, okay.
Survivors Group -COVID-19.
Okay.
There's probably other ones out there too, but that's the one
Okay.
I'm familiar with.
So you think that that's like a national or more of a local?
I think it's international. I mean, there's people that are posting from England that I've seen.
Okay.
Yeah.
Oh.
Yeah. Other places too, I'm sure, but I remember that. Yeah. Mm. Mm-hmm.
Right.
Good. Yeah. How horrible.
I lost actually.
Oh, I'm sorry. Right. Oh, well, you're very welcome. I'm glad you're getting better.
Okay, well then.
Thanks, Sue. Okay. Thank you all.
So
Thank
Beth,
you.
I just
Yep.
have one more question, Beth.
Oh,
Were
yes.
you, did you finally get tested positive then? Did they ever have a test?
Yeah, what ended up happening is I went to the hematologist because of the blood clot. And that was like on the 28th of April.
Okay.
And he sent me to get tested because he said they would feel better treating me if they knew that I was no longer positive. Well, assumed no longer positive. So I did go and it did come up negative at that time. And he said he wasn't surprised because by that time I was, well, symptoms occurred on the 2nd, so I was probably sick before that. I would love to know if I had antibodies, but up till now, that hasn't been a real easy test to take, I guess. So officially, I never tested positive for COVID because they weren't giving tests when I was sick. But like I said, the doctor put in his notes that it was probable COVID, adding that he couldn't test me. And I was asking, like, I called the nurses like 3 times and I said, well, what if it's pneumonia? And they're like, no. And they'd explain why it's not pneumonia. And then I'd say, you know, the strep throat. And I'd say, what about this? And it didn't fit anything else. So.
You.
You're welcome. Can I stay on while Doug talks and then I'm going to the store good and early so I can get home before the crowds. That's what I do.
Well, thanks for sharing, Beth. That was very helpful.
You're welcome, Sue. Thank you. I'm glad it helped.
Yeah.
Yeah, I echo that too, Beth, and we just hope that you continue to get better with those long-term effects that are hanging on. So take care.
Thank you. Yeah, that should be another thing I just mentioned quickly is that group that I am a member of, they do talk a lot about the long haulers. And a lot of long haulers are also posting in there and saying, you know, I'm this many months out and I'm still having this. Are you? Or what I've been seeing lately is a lot of, has anyone tested positive twice? You know, I had COVID back in March and now I'm testing positive in November, you know, that kind of thing. So anyway, thank you.
Can you hear me?
Yeah.
Okay. Is Doug on? I don't see him.
Hi,
Oh,
Sue.
there you are. Hi, Doug. Okay, well, this morning we welcome Doug Gearin, who is the director of the Winnebago County Health Department and our health officer for the county. And he has agreed to talk with us for a few minutes.
Sorry.
Regarding where we can get a COVID vaccination, a little bit about that, and who is eligible, the timeline, and any useful information you can give us regarding COVID. So thank you for coming, Doug. We welcome you, and you have the floor.
Great. Thanks, Sue. Good morning, everyone. I'll start off with just kind of bringing you up to speed with where we're at with vaccination in Wisconsin and Winnebago County. Am I able to share my screen? Looks like I can. So I'm going to go ahead and share my screen. And, oops. All right. And I'm going to bring up. Can you guys see COVID-19 vaccination data screen?
Yeah.
Okay, great. So as of yesterday morning, a little over 500,000 doses have been administered to Winnebago County residents. Remember that the population of Wisconsin is about 5.8 million right now. In Winnebago County, a little over 13,000 doses, but only 11,676 residents had received their first dose. And Winnebago County's population is about 170,000. So we've got quite a ways to go yet. And what we do on a weekly basis, and we're going to try to start doing on a daily basis, is to give a complete demographic breakdown of what residents have received vaccine and which ones haven't, so that people have an idea where the vaccine is actually going right now. You can see that within Winnebago County, roughly 18% of all of the vaccine has gone to those age 65 plus. The reasons that we see higher percentages, 7, 6, 7, 8% in the 25 to 54 range, is because of the first phase of vaccine rollout going to primarily to healthcare workers. And so that was quite a large population. And you can see it's also dominated by, it's twice the male count, 9% in male or females, 4.5% in males. And that's really just the makeup of our healthcare providers within Winnebago County. And then we also break it down by ethnicity and by race, so we can track that and try to reach populations that aren't receiving vaccine at rates that others are. And then you can see in terms of Wisconsin population as a whole, so to compare, our data, you can see what percentage of vaccine has gone to individuals in the various age groups. And you can see in Wisconsin as a whole, roughly 20% have gone to 65 plus. Stop sharing that. I'm happy to provide that data to you if you would like. It will be a part of our weekly reports and eventually make it onto our dashboard for the health department website. We've been receiving, so most of the vaccine that's been distributed in Wisconsin so far has gone to healthcare systems and to pharmacies that have been assisting in the vaccine rollout to nursing homes and assisted living facilities. The vast majority of nursing homes have already been vaccinated now, certainly greater than 80%. And there is progress being made with assisted living facilities. The other phase 1A, as it's called, healthcare providers are largely vaccinated at this point. We still have a little ways to go, and we're still continuing to vaccinate them. In terms of vaccine coming to the actual county, it's pretty low. We've received, I want to say, maybe a little over 1,000 doses of vaccine in total. We've been vaccinating for 4 weeks already. Now, what happened, with that reduced amount, we've been doing some planning with healthcare systems to try to get more vaccine out for the 65 and up population. We've been working with Aurora on setting up a site at the Culver Center at UW Oshkosh. That's in partnership with UWO. We were hoping to get kicked off this week, but it looks like it might be a mid next week launch for that, as that site still needs some final approval from the state. We were fortunate to hear from Ascension last week, Thursday. They were redistributing vaccine throughout the Ascension system, and we had an offer to utilize vaccine that they had available. And so on Thursday morning, we started work on a new clinic at the Expo Center. Now, we already had a pilot team from the National Guard out there and had been distributing some vaccine, but only with the limited amounts that we've been receiving. The last couple of weeks, we're only at 500 doses a week. The Ascension was able to pledge to us about 5,500 doses of vaccine. And so on Thursday and Friday, we plan to stand that clinic up and get it rolling on yesterday after a sign-up period on Sunday. So a lot of credit to the staff of the health department for really doing an amazing stand-up. I mean, within less than 2 days, we went from not having a clinic to standing one up and being ready to have it posted. So that we kicked off yesterday morning. Actually, we had some vaccine to give to corrections staff because we're still doing the first responders as well. And then in the afternoon, we transitioned to the 65 plus, and really the first 2 days were today and yesterday are for 75 and up, and we're really trying to prioritize those populations most at risk. We'll do roughly 1,000 today. We did about 500 yesterday of the 75 plus. We'll try to do 1,000 today, and then we'll work on doing 1,000 of 65 plus on Wednesday, Thursday, Friday, and Saturday. The weather may play a little bit of a factor. We're hoping that it won't be too bad. There's quite a front coming through on Thursday with snow, and then just a tremendous dip in temperatures for later this week. It's a bit of a walk from the parking lot into the Sunnyview Expo for those of you that have been there. So we're really hoping that things don't get too bad and we can maintain as many appointments as possible. The clinic went well yesterday. We learned a lot. We met from 7:30 to 9:30 last night to replan for today and get those changes implemented. Vaccine kickoff today starts at 9 o'clock. So staff are out, getting that set up. A big thanks to the Wisconsin National Guard. We've had a good relationship with the National Guard in terms of testing. We received one of the first pilot teams in the state to help train their staff, and did so last week. And it was great that on very short notice from Thursday that we were able to secure what we call 4 teams from the National Guard to help staff up the Sunnyview site. So what we have are we have greeters, we have registers, we have monitors for persons post-vaccine. Those roles are largely Wisconsin National Guard members. They have helped us with finding volunteer vaccinators, and we have supplemented with our staff to vaccinate and coordinate and just provide assistance for the rest of the clinic. So there are quite a few health department staff out there and other volunteers helping us out. We were running 8 vaccination lines yesterday. We anticipate running about 8, and we feel that we can do about 1,000 people with 8 lines. And it'll also really gear us up for our future efforts. The Sunnyview Expo site is a great site because we can really spread out in that facility. We definitely needed we're happy to take additional volunteers. Things move probably a little bit slower in a 75 plus crowd for vaccines. So we actually planned, that 1,000 is actually is a smaller amount than we would potentially plan for if it was more just a mixed general population, just because we anticipate things being a little bit slower on the movement side. So unfortunately, we don't know from week to week right now how much vaccine is available. I've already, worked with our staff and emergency management to put a request in for the National Guard to come back next week, 3 teams over 4 days. And I've requested 2,500 doses of vaccine from Ascension Healthcare. Both are pending approval. And so we need both of those things to fall into place in order to continue to run that clinic out there. We'll be able to lean a little heavier probably on the Guard with the experience that we all assembled together this week, and hope to continue that site. But it really could have to end if we can't get more vaccine. With that, we're concurrently still working to set up the site at Culver with Aurora, and they'll be the ones providing the vaccine out there. They'll be providing the registration system. We'll be providing all the vaccinators, and they'll also do the observation. So really, our staff are most supportive in the vaccination role in both clinics. The registration process is likely to change. We're hoping for a state-wide product to be released in the next few weeks, and one that we may be able to use across multiple sites. So people will hopefully be able to choose multiple sites from one location on signing up. Appleton Expo is standing up a site. They are vaccinating about 1,000 people this week, and had a registration event late last week. So if provided we have vaccine, we'll probably do another release and set up another registration process. In addition to the vaccine that we made available for the public to register on Sunday for, we put out that press release on Friday, shot for a noon Sunday event, so everybody would have a chance to get notified and have a chance to get at that vaccine enrollment process. All our spots filled, the 75s and up filled in about 30 minutes, probably about 75% of them within 15 minutes, and in about 40 minutes for the 65 plus for the remaining 3 days. So there's considerable demand. We've held a percentage of those spots open so that for persons that don't have internet access, that have not an ability to sign up through the electronic process that we become aware of, they can call our hotline and we can work to get them scheduled. If there's other priority populations that are interested in getting vaccine, we're certainly the 75 pluses. We want to hear from them because we really want to get those most vulnerable persons that are most susceptible to COVID infection vaccinated as quickly as possible. So we'll continue to try to make greater access and opportunity for those populations that are more likely to have an adverse outcome if they become infected. With that, we've asked the senior centers to identify persons that they're aware of and affiliated with, to start to send people our way and to get them to us so that we can get them registered, and encourage the Committee on Aging to do the same, to help us identify those most at risk, and help us get their info so that we can reach out to them and get them registered. So with that, I'm happy to take any questions that you have.
Could I ask a question? I have a neighbor who is 80 and hasn't been able to register for anything. Should they call the health department then, or?
Yep, use our hotline.
Which...
Our COVID hotline is 920-232-3026.
Okay.
And if the Committee on Aging is aware of a group of individuals, then like I've been working with the senior center in Oshkosh, if you can get me name, date of birth, address, and a phone number, I'll pass those on to our vaccination team and ask them to reach out and try to get them scheduled. And of course, we're not going to be able to get everyone scheduled, but we will work to get those at the highest priority scheduled first.
Okay, thank you.
And I heard some discussion about antibody testing before. I believe the Kroger stores are offering antibody testing. I don't know what the cost is on that, but if it's just you're curious to see if you've had it or not, that would be one way to get a confirmation.
Which stores, Doug?
So Kroger, Pick and Save stores do offer antibody testing.
Yeah. Okay. Thank you.
It's not useful as a diagnostic, but it certainly may help answer your question as to whether you actually had COVID or not.
Should potential volunteers contact that number as well, or how should they get a hold of you?
That would be great. That hotline number is a great way for persons that would be interested in helping, and really when we're for volunteers, if they can let us know, what their schedules are, if they can have a defined schedule, that helps us plug them in a lot easier. It becomes a lot of work to manage volunteers, and so anything that they can do to help define their skills and their times that they're available really helps us plug them in. And we do need extra support in these clinics where we're working with older adults. There's just a lot of unique needs, and we really want to provide support to help people get through that process well.
Doug, this is Deb.
And I want to, hi, Deb.
Hi.
I want to thank Doug too, because yesterday we did reach out to several people. We started with our database of individuals 90 and above, and then we went down to 85 and above so that we would reach out to the most vulnerable. And I think we forwarded probably about close to 30 names. So we there are people out there, no internet, very thankful. Many people that said they did get on, their family members registered them, but many people that just didn't really know how to actually get onto the to register for that vaccine. So if you do know of anybody, then get that number to them.
And so, Jean, that may be, we had very, very short turnaround notice on this clinic, and we'd certainly be interested in understanding what the senior center's ability is in assisting individuals to register that can't. And we certainly encourage through our press release that that people that know people that can't register because they don't have internet, or that's just not a comfortable way for them to sign up, to reach out and help them. And we really need neighbors helping neighbors, and family members helping other family members get registered. It's just the most effective way right now for us to reach a large number of individuals.
I'm assuming this is only for people, do they have to live in our county to come in? Do they have to live in Winnebago County to access the clinic? And do you check? How do you do that?
So they don't have to live in Winnebago County. We definitely are promoting it within Winnebago County to reach local residents as much as possible, but we're not going to turn someone away if they're not from Winnebago. I want to say a quick glance of all of those that registered on Sunday. I'm guessing about 85% were from Winnebago County, probably somewhere between 10 and 15% from Outagamie, and the remaining few percent from other surrounding counties. So it was more centric to Winnebago County than I expected it to be. I really expected a broader geographic area of those persons that had signed up. What we see at our testing site, so the National Guard testing site, is roughly right now, roughly 60% of persons are from Winnebago County, and the other 40% are from surrounding counties. And so I was a little surprised to see it's so much heavily on Winnebago County, but that may have been because of a short time frame for promoting it, and that promotion, being done locally as much as possible.
Sorry, another question. Are you having any trouble with people being no-shows for appointments and then not filling, like actually you thought you were full, but you weren't?
Yeah, what we found.
And is there a way for people then to contact you maybe later in the day and see if there's still openings?
Yep, people can. So what we found yesterday, and we'll learn more today, I think of the nearly 500 or so that we had, we probably had close to 30 no-shows, but we also had an equivalent number where couples had entered the registration process, registered one person, and then went to the registration process again, registered the spouse, but didn't get them on the same day because the spots filled up so fast. And so when those people came in, we just vaccinated them both at the same time. And that really kind of wiped out those that canceled. And when we were able to just serve those couples together right away together and reschedule them together for 3 weeks from now when they have their second dose. So yesterday was really kind of a wash on that. We really didn't have any open unused vaccine that we hadn't filled. Now, like I said, we have a number of spots that we hold so that we can fill people in, and we had no problem filling those spots up for yesterday and really for most of today. I think of the 1,000 spots that are available today, I think we probably started the day with maybe 30 openings because we had booked a lot of people in to that. We did have some cancellations, but likewise, we'll probably have people coming in that have appointments on different days, and we'll try to accommodate them the best we can. We're really not taking much for walk-ins, and we're trying to discourage walk-ins. We'll probably end up doing a few, but we just don't have the capacity to take a lot of walk-ins.
This is Deb. I was wondering, because it sounds like, we're ready to go, like on our end to meet the demand. So when there's no, like when you're out of vaccinations, where do you have to wait for them to come from?
Yeah, the vaccine process right now, ordering process, is that every entity registered as a vaccinator has the opportunity to order from the state once a week. And so today is the day that we have to put our request in for next week. And it's same, the healthcare systems, health departments, pharmacies, you name it. Then we find out on, Friday or Saturday how much vaccine we're actually going to get, and then it's delivered on Monday or Tuesday. The state is working, and the feds are trying to help out with giving us a little bigger window into vaccine, because right now it's pretty, it's a lot of faith going on in terms of how much vaccine we're going to get. in pre-requesting, and we have to request the guard resources a week in advance too, and wait for that approval. So, you know, hope and a prayer is kind of what we're working on here in terms of making sure that everything aligns and that we're able to have the staff and the vaccine to run a clinic. So all that has to pull together. Prior to this, you know, we've been getting between 200 and 500 doses at the health department and just running them at the health department. We'd love to continue to get those larger amounts of vaccines so that we can get through the priority populations much more quickly. The hospital systems are really key for that because they do get a lot more vaccine and access to vaccine than we do. So the vaccine that we're running at this clinic is Pfizer vaccine, and it had to be shipped up from Milwaukee because Ascension centralizes their vaccination receipts through the Milwaukee headquarters for the Wisconsin area.
Doug, this is Sue. I just wanted to commend you for I went to the site of Appleton and you know how they overbooked a whole lot of people in just 15 minutes apparently. And then these 4,000 people got kicked out. They didn't have an appointment. But your site was really nice because as it filled up, it turned red and you knew that you had to go to another time slot. So I commend whoever did that because they did a super job. And the other question I had was if a person comes to Sunnyview, are the directions pretty clear where they go in their car to get where they need to go? Older people sometimes get confused easily. And I just wondered how that was laid out.
Yeah, there's only one entrance and there's a post that when people drive in, they stop at and they're able to get directions from a live person based on whether they're coming in for a vaccination or they're coming in for a test on where to go. And so it's easy to get instructions once you get there. Right now we're using the what would be the east entrance, and the other the west end is the exit. The east is the entrance. The main gates are actually closed.
Okay.
So it's a one-way flow through the grounds.
Okay. So if a person has an appointment, say at 9, should they plan to get there like 15 minutes early, or how does that work?
Yeah. So I think one of the challenges that we saw yesterday and that we've asked people to accommodate is to stay in their cars until 5 minutes before their appointment. We had 50, 60 people in line outside of the expo center yesterday. And, you know, I can tell you that, you know, while this group is very excited to get vaccinated, they're also, it seems that, you know, they haven't practiced social distancing a whole lot either, because they've probably been in their homes a lot. And so, yeah, and the other part is, you know, when you drive in and you see 50 people in line, well, you don't want to miss your appointment. So what do? You get out and you get in line. And it just, it kind of, it's a negative feedback loop there. And we made some arrangements operationally overnight to increase the size of the area inside where people could sit and wait for their appointment so that we could try to avoid the line outside. And especially with the bad weather coming, we can't have people standing outside in 0-degree weather and waiting for their appointment. So we're really asking people, and we're telling them when they come through the gate, you know, stay in your car until 5 minutes before your appointment. We'll get you through. And really, frankly, our appointments are really just meant to regulate flow. You know, if somebody's, you know, 5 minutes early or 10 minutes late for their appointment, that's okay, as long as we're pacing the process. That's all it is. The appointment times are just a pacer. It's not a, you know, if you're 2 minutes late, you're not going to get a vaccine. That's not the case. We will serve everybody that, you know, has signed up.
Thank you.
So hopefully we'll have more information to share with you later this week. Unfortunately, it may not be until Friday or the weekend. And then hopefully early next week, we'll have an opportunity to do something with Aurora for a secondary site for people to get vaccine. And that'll hopefully grow over the coming weeks. And right now, vaccine's going to be flat for the next month. I mean, we're getting a little increase at the federal level. I think last week when I was on a national conference, they were expecting about a 16% increase, but it was going to be all Moderna vaccine, which actually is good because it's easier for us to handle. But we're still at a place where we're making sure that whatever your first dose is, that's what your second dose is.
Hey, Ron, Spectrum kicked off Judy, so if you could direct the meeting.
Okay. All right. Any other questions for Doug?
Yeah, I just have one, Doug. So the individuals are getting their first shot this week. And then how long do they wait till their second shot? And do they come back to, are they going to be coming back to that same Sunnyview site, or are you directing them to a different site?
Yeah, no, great question. We tried to make that as simple as possible. The waiting period between vaccine doses for Moderna is 3 weeks. Excuse me, for Pfizer is 3 weeks. For Moderna, it's 4 weeks. Everyone that's coming through the clinic this week has an appointment at the same time and the same day 3 weeks later. So if you come Tuesday morning at 9 o'clock, 3 weeks, Tuesday morning at 9 o'clock is your next appointment right at Sunnyview.
Okay. I think we've run out of questions for Beth. So thank you both for presenting this morning. We sure appreciate it. And we'll keep in touch with the Winnebago County Health Department's website for all the latest information, Doug. We appreciate that. Thank you.
Oh, thank you. And if you've got any suggestions for us, like I took some notes on the COVID survivor info. If you have some links that we can include on our website or you think are really good, I'll definitely have our staff work on that because I think that's probably a need as well.
Okay, great. All right, thank you very much.
All right, thank you.
Okay. Okay, we'll move on to the old business, and there's none there. So right on to the new business. Be HA on your agenda. Discussion and information pertaining to strategic plan. This is something that we've been holding over for several months, it seems. And Judy was going to have the first several sections. I guess she is not back on yet. I think everyone got a copy of this, by the way, probably at least twice via email. So you've had a chance maybe to look at it already. So we won't spend a lot of time reviewing it, probably just to hit some highlights. One of our goals is to continue to invite individuals to present regarding issues related to older adults. And last year, of course, that was a task. So we didn't get to a lot of the things that were scheduled. We did have Evergreen Retirement Community present, as well as Brain Fitness Cognitive Therapy that Julie Davids nicely did for us. But a whole bunch of other things that were planned for last year did not happen, but are still things that we want to get to later this year. I see Judy is back on, so if she wants to take number 2 on the report, she may go ahead. Or aren't you with us yet, Judy? I will just proceed. The second one is to continue to get service and I'm sorry.
I am on.
Okay, you're sort of breaking up and
Apparently I'm not on again.
buffering from what I can
Can you hear me
see.
now?
Yeah. I can hear you now.
Go ahead. Okay, we need to get our seniors in the community using TV, all the various forms of media, social media, everything. And as I look, so we want to really build on the collections we already have. We want to review all of our goals and what we've already got in the works. The pandemic is going to continue as much as available. Or you kind of so
Sue, did you want to add any comments on the sections that you were dealing with, or?
Because this isn't working. There isn't anything really new here. We're just going to reach out to like either the Northwestern or the Oshkosh Herald to get a recap of our meetings. That's one goal we had. We're continuing to televise our meetings, and I think we're doing a good job of reaching out for groups and membership. And number 5 was just continue our efforts to communicate with the services on the City of Oshkosh website. So we're going to try to enhance the page a little bit and link the community services, and that's about it, really. So we reviewed this one other time, and things really haven't changed that much. We just need to do a little work in a couple communication areas.
Okay, thank you. The 6th area has to do with increasing the number of seniors with advanced directives. And at our next meeting, that will be the focus with the Fox Valley, let's see what they're called, the Fox Valley Advanced Care Planning Partnership. And also Winnebago County ADRC will be with us to give an update on their efforts and their linkage with the senior center. So, and the final area had to do with taking advantage of opportunities to increase visibility of our Committee on Aging. And hopefully there'll be workshops and expos and things like that that'll open up in later this year that we can actually do more of that. That's where we're at and where we're going. And I will move right on quickly to HB. The 21 Medicare Part B changes. Real briefly, this was something we were going to deal with in December when it was actually news. And then our January meeting was canceled. Our January meeting, we held it over. But just to reiterate for people that the increase in their Medicare Part B premium went from $144.60 to $148.50, a $3.90 bump. But the annual deductible for Part B also went up from $198 in 2020 to $203 in 2021. And then the Part A deductible for hospitalization period, each period went up from $1,408 to $1,484, a $76 jump for 2021. And then moving right on to the governor's task force, I see the first screen is up. And as we've reported at several meetings earlier, mostly in late in 2019, the Governor Evers had commissioned a task force to look into caregiving and the issues related to it and how we can strengthen in caregiving by families as well as public providers going forward. And you see the cover sheet of that report on screen right now. And if you could move to the next screen, Bobby or Ann. The next screen has to do with the letter to the Wisconsin governor. I just want to point out in this slide, and if you could move to the next slide, I'd appreciate it.
Hey Ron, we're having a problem moving to the next screen.
Okay. Can you go to the third one?
No. So I'll share with Bobby what will have to happen in the future on this, but I can't delete what's on here.
Okay.
No, it's not working.
Okay.
Let's just proceed and make that available on the website or a copy at the senior center, please.
Well, it can be attached to the minutes too that are posted on the website. Well, then just a couple of points that I want to highlight regarding what you otherwise would have seen. It's estimated that there's 580,000 family caregivers in Wisconsin and more than 90,000 direct care workers in the state of Wisconsin. So we're talking about a lot of people here who are caregivers and are in need of support in many ways. And the Wisconsin Caregiver Report that was completed in their summary, which I was hopeful to show because it's a little easier to show than to tell. But they did the report in September of 2020. That's when they actually finished the report. They had 1,500 people giving input into the output for this. There we go. If you can go right to the next slide right away, that'd be great. I'll just go on there. In the summary report, there were actually 3 different areas that they focused on. One were recommendations as to what needs to be done to support family caregivers. The next section, and maybe just to highlight that, the major advancement there was a caregiver assessment, requiring a caregiver assessment that would be a tailored caregiver assessment and a referral proposal. And that would really enhance the support to caregivers because they have a lot of needs also when in their caregiving role. And I guess over the years, there's been an increasing awareness that if you can support the caregiver, you're going a long ways toward taking care of the person who needs the care. So that's one section. Another section has to do with direct caregiver workforce proposals having to do with rates, benefits, and untapped worker sources. And you may have seen some of these ads on television already from the Department of Health Services, Wisconsin, actually looking for and trying to recruit people back into the direct care workforce. And then the final area has to do with the home care provider registry that would be statewide. And that, are you able to show the further up or further down on the page at all, Ann?
We can scroll with our own mouse and you can see it.
Oh, you can. Okay. All right. Okay. Individually, people would need to do that. Okay. So anyway, if you are scrolling with your own mouse, you'll see those areas that I was just referring to. The family caregivers, there's 5 different sections or recommendations under that, under the direct care workforce proposals, again, having to do with rates and benefits and untapped. And then finally, the home care provider registry. So this report lays out the process and the rationale used by this task force member, the task force members. There were 28 of them, by the way, to develop the 16 proposals that you see on the screen. And those proposals in full and the conclusions and discussion and all of that, and the next steps and all of that is in the, I think it was like a 60-page report. Let me double check. Yeah, it's like 60 pages. And if you can go to the next slide, Ann, the final slide, you can see where you can actually go and look up the actual report. It's very detailed, and they get a lot of good examples, sharing the input they've got from these 1,500 people. I don't see it online yet, but to view the final Caregiver Task Force report, all you need to do is search GTFC. There you go. Just the gtfc.wisconsin.gov will get you there. Okay, and if you scroll down, if you want to actually watch a recorded presentation delivered by Lisa Pugh and Todd Costello, who were the co-chairs of the task force, they delivered this particular presentation on September 16th. Just do a search, Governor's Task Force on Caregiving Recommendations Overview, and it'll be right there. And there's a button to click on to watch the, I think it's 1 hour and 19 minutes presentation. Very well done. And that way you'll have the whole story. So we'll be giving updates regarding progress in actually implementing some of these recommendations, because some of them will have to go through the legislature in the next year. So hopefully there'll be progress, and caregivers will get a little more support than they've seen in the past. So that's it.
Okay, thanks, Ron. Is there any other business before the group? If not, I'll take a motion to adjourn the meeting to March 2nd. Our speaker will be the Advanced Care Planning Partnership and the ADRC with Melissa Sell, also working with Advanced Care Planning. A motion.
So move.
I'll second. This is Julie Kiefer.
Okay. Those in favor, wave your hand.
Aye.
Wow.
Thank you.